Hello, I would like to give a summary of the communications regarding follicular lymphoma that were presented during the oral session of the ASCO 2017 annual meeting. There were 4 communications, 2 of them updated clinical studies evaluating the role of bendamustine in the treatment of patients with follicular lymphoma, the BRIGHT study and the STILL study. The update of these studies both confirm the initial results found and already reported. In the BRIGHT study that already showed that the response rate using bendamustine rituximab was better than R-CHOP and R-CVP, the 5 years update confirmed that there was a significant benefit in terms of progression-free survival for the treatment of patients with mantle cell lymphoma, and that there was a trend for a better PFS for those with follicular and other indolent lymphoma. However, the investigators looked at the toxicity associated with the use of bendamustine rituximab and found that there was a numerical but non-significant increase in either unrelated deaths that were unrelated to lymphoma, and also of secondary malignancies, which resulted in a non-significant difference in overall survival, actually not favoring BR. So it's a mixed message regarding this 5 years update, confirming the initial result, but still bringing some highlights regarding the potential toxicity of BR in patients with lymphoma. In the STILL study, the 10 years update presented by Dr. Rummel showed that the improvement seen with BR in patients with indolent lymphoma over R-CHOP was maintained over time, with more than 50 patients being free of disease recurrence of retreatment at 10 years and an overall survival of 70%, without an apparent excess of toxicity. The take-home message here is that clearly BR is a good option for patients with indolent malignancies, but whether it's always the optimal still remains to be discussed given the toxicity observed in this study as well as in the gallium study that was previously reported at ASH. 2 other communications actually address the issue of patients with early failure after first-line treatment. One of them gave preliminary result of the R-square combination lenalidomide plus rituximab and shows that about 50% of these patients with early failure were responsive to this R-square regimen after longer follow-up is clearly needed. Another one reported the CIBMTR data, transplant data of patients with early failure, and showed that different kind of transplant could be useful for those patients. Matched sibling donor transplant, autologous transplant were both efficacious in bringing patients to a second remission and long-term survival, with no difference between the 2 approaches in terms of overall survival. So obviously there were more relapse after autologous transplant and more toxicity after allogeneic transplant. What this study shows is that matched unrelated donor may not have been the optimal approach for this patient, resulting in increased toxicity and lower overall survival. So still very interesting message regarding the optimal management of patients with follicular lymphoma presented during this meeting.